Good afternoon, and thank you for joining us for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 1,211 new cases of COVID-19. This brings our statewide total to 7,016 Pennsylvanians who have tested positive for COVID-19 now in 62 counties. Approximately 730 patients have been hospitalized since our first case was announced on March 6th. That continues to be approximately 10% of the patients. 216 of those hospitalized have required intensive care, and 130 of those hospitalized have required the use of a ventilator or a breathing machine. Approximately 345 of our total cases are in healthcare workers, and approximately 10% of our 695 licensed nursing homes have at least one case of COVID-19. Tragically, we have now had 90 deaths among those who have tested positive for COVID-19. To date, all of those deaths have been in adult patients. I know that staying home, according to the governor's stay-at-home orders, which are now statewide, is not easy. It's particularly hard for families with children who are really completely out of their normal routines for this time of year. No matter their age, children are also dealing with stress because of this virus and the pandemic due to COVID-19. If they are younger, they might not understand why they can't go to school, why they can't visit their friends or their grandparents. And if they are older, they might be facing the fact now that the goals they set for the beginning of the school year are on hold or delayed. Or they might feel isolated because they cannot socialize with their friends, they can't participate in sports. And we always have to be careful that they aren't involved too much with social media. Now remember, I'm a pediatrician in my original training, and so this issue of children and teenagers is very, very important to me. Our kids take their lead from the adults in their life, particularly in what you do, not necessarily what you always say. Kids follow what your actions are as parents and adults. So here are some things and some tips of what we should practice. Routines are essential for children. Most kids are used to getting up to go to school or daycare each day, and so try to set a normal routine for them, even teenagers, so they can start to feel a sense of normalcy in their lives. The more the routine is in terms of when they get up, when they eat their meals, when they might be doing schoolwork, when they might be participating in more fun activities, when they eat dinner, when they go to bed, the more that that is scheduled, the better it is for children and teenagers. Set a time, maybe once a day, with children to get us the latest information about COVID-19 from a trusted source, maybe the Department of Health website or a trusted news source. Now, listening to the news coverage as it comes out is important, but it can be overwhelming, especially if it's on all the time. So, many families have been basically watching their trusted news source, and they keep it on all the time to get a sense of what's going on in the world and in Pennsylvania. But that can be very, very stressful for children. And that's true for social media as well. And make sure that you take your own advice. Children, teenagers, watch what you do as much as what you say. Kids are watching how we react to cues, and then they respond the way you respond. So try to make sure that you follow a routine as well as parents in terms of when you get up, when you're eating, when you're sleeping, etc. Those are very important routines to teach our children. Now, if you or anyone you know needs mental health resources or experiencing a mental health crisis, contact the crisis text line by texting PA to 741-741. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or as you all know by now, the time it takes to sing happy birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch your face, especially after touching a surface. And clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of this dangerous virus, COVID-19. If you have questions about your health, please contact your healthcare provider. And for the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And as most important for Pennsylvanians to remember is stay calm, stay home, stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From the Scranton Times, you've talked in recent days about the complexity of modeling and the efforts underway with your university partners. What do you say to hospitals and other providers that are trying to prepare now for the outbreak peak by apportioning and perhaps conserving limited resources when they don't seem to be getting clear guidance from the Commonwealth as to when that peak is suspected to happen or what it will look like?
Well, I think the modeling is important, and we're working with the University of Pittsburgh School of Public Health on their modeling and have conversations with them regularly. We also have been watching the University of Pennsylvania's modeling, which is particularly for Philadelphia. There's modeling from the University of Washington. There's other models that we follow as well. But most important are what conditions are now. And so we are speaking with the hospitals and health systems every day. And so we are giving them a lot of guidance and recommendations in terms of preparing for the surge. None of us know exactly when that surge will occur, and it's not one day that it surges. It'll be over time. And so we are working on that preparation now. Dr. Fauci, the head of infectious diseases at the NIH in Washington, has said that really the virus will determine the timetable. We don't determine the exact timetable, including with our modeling. So we're working with the hospitals, with the health systems, with the Hospital Association to prepare for this surge, which all models say will occur over the next number of weeks or a month. The most important thing to remember is that we need to try to prevent the surge from potentially overwhelming our healthcare system. And that is why the prevention efforts and the mitigation efforts that the governor has put in place, including now the statewide stay-at-home order, is so important.
Secretary, from WFMZ, of those intubated and placed on ventilation, what is the survival rate, and how effective are ventilators as a treatment?
So ventilators are a very effective treatment for individuals that are not able to breathe on their own. And so it is in critical care and an intensive care unit. And ventilators are not just used in response to COVID-19. They're used in response to any condition where a patient cannot breathe on their own. I actually don't exactly know the death rate, and we can look that up. We can try to analyze that. But of course, patients who are placed on a ventilator are the most ill due to COVID-19. Don't know the exact rate. We'll try to look that up. But ventilators are very, very effective and, really important for our healthcare system.
Secretary, WNEP would like you to recap, I believe, an answer that you gave the other day about businesses being required to notify an employee when a fellow worker tests positive for COVID-19, and which employees will be notified, and how does that process work?
So a business will notify close contacts of that person who has tested positive for COVID-19. So that person, of course, will be in isolation. So if they're not very ill and they don't require medical attention, then they will be at home resting and recuperating. And if they do require medical attention, then they might be in a hospital. And then so close contacts of that person will need to be quarantined for up to 14 days. Then the business will need to be have a very, very vigorous deep cleaning, and then regular business can return. Now, of course, this would be a business that is accepted as a life-sustaining, essential business under the governor's orders.
Secretary, from the Scranton Times and the Morning Call, some questions about Northeast Pennsylvania in terms of the caseload there being 10,000 people is essentially caseload per 10,000 people is 3 times that of Philadelphia and the collar counties. Can you speak to the significance of this and especially to what it might mean for hospitals in those counties?
Mm-hmm. So we have noticed that trend as well. The recent increases that we have seen in Pennsylvania over the last number of days have been primarily in the southeast, particularly Philadelphia and the collar counties of Philadelphia, and in the northeast. So we're paying close attention to that. We're tracking it very closely, and we need to make sure that the hospitals in that area are prepared to take care of those patients.
Secretary, a couple of questions about the data from WJAC. Wanting to know why the state isn't breaking down the number of negative tests by county like we do with positive tests. And many viewers would like to get a better sense of how many tests are being done in each county.
Well, so I know that information would be interesting. Be honest with you, we haven't been breaking it down by county because we're not finding it that useful from a public health perspective. So we're really trying to concentrate on the data to inform the public, but we also are concentrating on data which is informing our public health response. That's also, I know there are questions about trying to track who has recovered from COVID-19. That will be really determined over the next number of months and even a year or more as we look back upon this outbreak and pandemic with COVID-19. We don't track the thousands of patients who have COVID-19 and to see when they recover. I think that as more serology testing becomes available, the FDA just approved a new serology test today. So we'll be looking into that, but that will best be used to determine in the future who is immune from COVID-19, and that will help us in terms of our preparations for the future. Right now, we're concentrating on 3 things: the mitigation, the testing of those with significant symptoms of COVID-19, and then working on preparing the healthcare system for the expected surge.
We have questions about the reporting time from the Reading Eagle and News Talk 104.1. First, in a death reporting, when it's reported by a coroner one day and then registered several days later by the state. And then second, if county doesn't have a local health department, does that slow the reporting of positive cases?
So it does not really slow the reporting if a county doesn't have their own health department, because they do have a health department, and that's us. That's the Pennsylvania Department of Health. And we serve as the health department with our great public health nurses for many of the counties in the state. Of course, we do have 10 county and municipal health departments we work with really, really closely. We get a report on our computer system and our data system as soon as it's entered, and so and we're collecting all of that data at 12 midnight. And that's the data we report to you at noon every day, and then what I review in the regular press conferences. So we're getting it as soon as it's inputted into the system.
Secretary, from NBC 10. What's your stance on the Limerick power plant and the decision to bring 1,400 to 1,800 workers from out of state in reference to the refueling of the power plant?
Mm-hmm. So I understand the issues associated with that. Of course, energy is an essential function, and we have to have power for our hospitals and our health systems and for all the citizens in Pennsylvania. We are working with Montgomery County really closely, and I know they're working with Exelon, the owner of the power plant, to make sure that all necessary safety measures are in place.
Secretary, from WNEP, a viewer has been prescribed hydrochloroquine, says her medication is now unavailable because of a shortage due to interest in its use as a treatment for COVID-19. What can people who depend on this medication do?
Well, so hydroxychloroquine is a medicine that is used in other conditions. One example would be rheumatoid arthritis. And so we are doing everything we can to make sure that the supply of hydroxychloroquine is present in pharmacies. So we have reached out and are working with the Pharmacy Association, the Board of Pharmacy. I know the FDA has been working, that even though it is an investigational medication for COVID-19, that it still be available for patients who use it for current accepted treatment.
From WTAE, many new COVID-19 tests being approved by the FDA on an emergency basis. Now, recent research suggests more false negatives are possible from these tests than you would otherwise expect. Should we be concerned here in Pennsylvania? How should people with symptoms take the possibility of false negative testing?
Well, so I know that the FDA is approving on an emergency basis a number of different tests to try to get more testing be available. Right now in Pennsylvania, we're using very well accepted tests that have been used for weeks and weeks now at our state laboratory and at the hospital laboratories, and by use with Quest and LabCorp. But all tests have a certain false negative, false positive rate, and we'll be tracking all of those really carefully. In terms of who should be tested, so we've talked about that, and it is a fine balance. If you have symptoms of a fever and a cough, and you're really not feeling very ill, it isn't that high of a fever, your cough is mild, and you're not having severe chest pain, you're not having shortness of breath, it isn't actually essential that you get tested. And we would assume now that you have COVID-19. And that would be also in terms of contacts to people who are either known to be positive or to someone who has those symptoms. So we would want you to isolate and to take acetaminophen to help your fever, and to drink plenty of fluids, and to rest and recover from this viral infection. If, however, you're starting to feel worse, if your fever is spiking, if you're having severe chills, if you're not able to keep down fluids, or you're not drinking enough, if you're having chest pain or shortness of breath, please don't wait. Please contact your healthcare provider to discuss your symptoms to see if you need to be seen and evaluated. So it really is a very fine line. Of course, if you have an emergency, call 911 to seek emergency services.
From WESB, how accurate do you think the numbers are when rural counties like McKean, Warren, Elk, et cetera, have so few test kits?
So we think that the accuracy of our testing is very, very good, and we are noting the positive cases. But as we've been saying, there is community spread of COVID-19. There is a variety of different clinical responses that we see in patients. Some patients have very few symptoms. Some patients are critically ill. There might be patients who really tolerate the virus and don't have any symptoms at all. So we know, as Dr. Fauci from the NIH has said, is that the number of true cases is far above our case count. And so we would expect with this community spread that there are a lot of cases. And so we're taking that in consideration in terms of our numbers.
From WPXI, what are the lessons learned from looking back at previous pandemics, like the Spanish flu of 1918 and others, that could be helping us fight coronavirus?
Well, I think the lesson that has been learned from 1918, of course, that was more than 100 years ago, and medical care was very different. But I think the lesson is in terms of the importance of social distancing and the prevention efforts that the governor has put in place. There have been a number of articles which contrast the response in Philadelphia to the response, I believe, in St. Louis or some other cities where the parades were scheduled. And in St. Louis and some other cities, they canceled those parades. They asked people to stay at home. In Philadelphia, the parades went forward. Philadelphia had a much more serious outbreak of a pandemic flu in 1918 than did those other cities. That is also the lessons from other countries, which were very, very quick to institute social distancing and these prevention methods. So it highlights the critical nature of the stay-at-home order that the governor instituted, and we really absolutely require people to stay at home to prevent the spread of this very dangerous virus.
From News Talk 104.1, for those that test positive and don't require a hospital stay, is the recovery window approximately 14 to 21 days? And as a follow-up, is that the same for those who do require a hospital stay?
Well, for those who are more ill and require hospitalization and treatment, their course is lasting longer. For those who have a mild illness, they have a shorter course. And there are specific criteria established by the CDC for when someone can resume their normal activities. That's available on our website.
From the Pittsburgh Business Times, can you discuss the level of patient surge you're seeing in various sections of the state? We've seen increasing levels in several counties in western Pennsylvania. How are the hospital systems by county managing this?
So we have seen particular surges, as I mentioned, in the southeast, in Philadelphia, and in the Collier counties, and increases of cases in the northeast. There are states in the southwest that have seen an increased number of cases, but not as large of an increase. And right now, the hospitals and health systems throughout the state are coping very well. We are working with them every day to make sure that they have the supplies that they need to take care of patients that are infected with COVID-19.
From Public Source, the number of cases is rapidly rising in counties near Allentown and Scranton. Is the virus's epicenter spreading from Philadelphia, or are there more tests being completed there now?
So I think that the increase that we're seeing is not just more testing. I think that there are more cases as we have seen widespread community transmission of the virus COVID-19. So we can't tell exactly what the travel patterns are or why we are seeing more in that area. I think we're seeing more because it's very prevalent. There's widespread community transmission. We're seeing more cases.
And as a follow-up for that, Lehigh Valley Live, with deaths rising in the Lehigh Valley, is the Department of Health or the counties requesting mass testing or other emergency measures like field hospitals?
Well, so we have two field hospitals being set up now. Those field hospitals are from the Health and Human Services and the federal government, and they determine how many we get. So there is no indication at this time that the federal government will be sending us any more of those field hospitals. But we will be working with the hospitals in Northeast Pennsylvania to make sure that they can handle the capacity of patients. We'll have a number of different alternative sites that we can use. We've been discussing about ambulatory surgical facilities, and then either hospitals that have just closed that we might use to take care of patients, maybe other patients, so that COVID-19 patients can be taken care of in the acute care hospitals, and then even hotels to help patients convalesce in the subacute period.
And as another follow-up to that, WPSU, should counties in the center and north central part of the state expect to see the same type of increase that the southeast and the northeast are seeing? Well,
we would expect increases throughout Pennsylvania. Of course, a number of those counties are much less populated, so they have less population density. Thus, there is less chance for community spread, but it could spread there, and that's why the stay-at-home order is now statewide.
From WLVR, how are Pennsylvanians supposed to mitigate their regular health care needs during this time? At some point, people will need to see a dentist, a doctor, a dermatologist, and other specialists to stay healthy. Are you offering any advice for how to seek out typical medical needs?
Well, for urgent needs, we want people to see their doctor. So patients who have hypertension that's not being well controlled, of course, patients with kidney disease on dialysis will need to continue to have dialysis. Patients with lung disease who are having problems will need to see their doctor. But for routine medical care, for routine checkups, whether that's dental checkups or other medical checkups, we're asking people not to do that. When you're entering the healthcare system, there will be other patients there potentially with COVID-19, and that puts you and your family at risk. So please stay home. This will not last forever. There will certainly be the opportunity for patients to get routine care and to get back on schedule.
And then, Secretary, from News Talk 104.1, do you have an idea of whether or not there's been an increase in calls requesting mental health services since the stay-at-home order was issued last night?
So I don't have information since last night. I know that there have been an increase in terms of mental health calls to the Department of Human Services and their divisions. I don't have specific numbers on that, but as we've been saying and said in today in regards to children, but also in the past, this is a very stressful time. This is stressful for families and parents and children. This is stressful for seniors who are very concerned about their health and their families. It's incredibly stressful for healthcare personnel treating patients with COVID-19 as well as other ill patients. So it would not surprise me if there are more mental health calls, which is why I highlight the text number every day.
From WFMZ, if someone travels to New York City but wears an N95 respirator, do they still need to self-quarantine for 14 days when they return?
So we are asking anyone, according to President Trump's messages, as well as the governor's messages, that if you're coming back from New York City, to please quarantine for 14 days. The N95 mask is not 100%. Also, you could have touched surfaces and been exposed later. So, yes, we are asking you to quarantine for 14 days if you're returning from those areas.
From the public source, you said that 345 total cases are in healthcare workers. Do you know how fast those cases have been increasing, and how does that compare with other states?
I don't have those comparisons, but we can work on that.
Okay. And then from News Talk 104.1, how would a BiPAP machine be used for someone who's quarantined at home?
Well, if someone is quarantined at home, quarantine meaning that you have no symptoms and that you've been exposed to someone with COVID-19. So if you have, I think if they're thinking of CPAP, then you would use your CPAP for sleep apnea as you usually would. If you're isolated, meaning that you are positive for COVID-19, you would need to continue to use it, but you would need to be really, really careful in terms of your respiratory condition. Those with underlying lung conditions are more at risk of having complications from COVID-19. And so we would want you to be in close contact with your healthcare provider, and if there's any question, please get evaluated.
Secretary, our last question today is from the Scranton Times. Has health given any thought to breaking down the positive tests by municipality? New York does that. Callers tell us they'd like to know if someone infected might be in their neighborhood. So
we're not going to release this by municipality, and so we're going to release it by county. And again, I know that people would like to know if someone in their neighborhood might be positive, but we're asking you to stay at home. That individual, if they're positive, will be isolated. They will not be out and about. And so the best thing that you can do for your health and the health of your family is please stay home.
Thank you, Secretary. For any reporters whose questions we were not able to cover today, we will get back to you by the end of the day from the Department of Health or the Governor's office. Thank you so much. Our next briefing will be tomorrow.